Hi, my name is Lauren Sands. I'm a pediatric dietitian and lactation consultant here at Compleo. I'm here to talk to you today about what to expect at your initial newborn lactation visit. So the first thing is when, and that can really be at any time. I love to see parents and babies as soon after delivery as possible so that if you're having issues, we can help you get through those issues faster, or if you're not having issues, so that we can confirm that and we can help you feel confident with feeding as soon as possible. I love it for dads to come to appointments or your partners to come to the appointment. They're really helpful. That's who's going to be at home with you in the trenches, and so it's really helpful if they can be there to kind of see what I'm seeing so that I can give them tips on what to look for at home when it comes to positioning or supporting you and really making sure that you're comfortable during the feeding session. When you're coming to an appointment in clinic, it is lovely if you can bring baby kind of hungry, but not yet hangry, which is a really hard thing to accomplish in the newborn period. So I really just ask that you do your best. Please don't feel like you have to push baby, hold baby off too long for feedings just for my sake. If they eat a little bit before they come, it's totally okay. During the visit, some things that we'll do is, it's very important to me to hear your side of the story. So I'm always gonna ask you, what's going on? How are things? What are you struggling with? What's going well? And I'm just going to sit there and I'm going to listen because you're living it and you know what is most important to your journey. So I'm just going to sit there and listen. And while I'm listening, I'll be thinking of questions that are important to ask along the process and things that I want to make sure that we look at a little bit more closely. But I always want to hear from you because your intuition is way better than any lactation agenda that I may have. So we'll sit and we'll talk for a little while, and then we will get baby dressed down to just a dry diaper so that we can get a very accurate weight on them. That's one thing that's really important to feeding and growing your baby, is making sure that they're growing appropriately. And so we'll weigh them and I'll track their growth, and that will give us some information overall on if they're taking enough milk. After that, we will put baby to the breast and we will let them do their thing, and I will help adjust and coach as needed. We'll talk about what feels comfortable and about how baby looks and things to look out for when you're doing at home. Oftentimes we spend the most of our appointments sitting here answering questions and chatting while baby's doing their thing at the breast. But it's a really great time for us to make sure that we're answering that list of questions that you have typed in on your phone and brought with you. And after baby eats, we'll get to weigh them again, and that will give us some information on how much milk they took from the breast, which will help us as we're planning on what we want to do and what strategies we want to take between visits. And sometimes I will also do a very gentle oral examination where I'm looking around in baby's mouth to see what their suck feels like and what their anatomy and their structure is. And this also gives us good information if we're struggling with maybe pain or poor milk transfer, those sort of things. And we'll also talk about your past medical history. We'll talk about pumping. We'll make sure that our supply is good and that we're supporting it for the long term. And really just any question that you have about feeding and growing your baby, we'll talk about it. We'll talk about all of it. I do like to note, though, one of the things that I think is really important and that all providers should be aware of is that it's very overwhelming to be in the postpartum period. And so it is my goal to always hear all the things that you've got going on and then help us prioritize which ones we're going to work on first, instead of just giving you a whole bunch of information and a whole bunch of things to work on too much at a time and just becoming a very overwhelming situation. I never want you to feel overwhelmed. So you bring me all of your problems and we'll kind of come up with a solution of the best way to help you to overcome the struggles that you're having so that you can feed baby with confidence and so that you can enjoy the process, because you deserve to enjoy that little newborn. You worked hard for them. So after that initial visit, I typically will follow up with my families once or twice a week, kind of depending on what's going on. while we're working on weight gain or getting that latch to feel more comfortable. And then we transition into maybe just once a week, maybe every other week. And then I'll usually see babies back whenever we're getting ready to introduce a bottle, whenever we're getting ready to go back to work, whenever we're getting ready to start foods, or whenever we're ready to wean or introduce cow's milk, and all of those sort of things. So the care plan is very much individualized to mom and baby and what you need, and as often as you need it or as infrequently as you need. I'm here to serve you and really just make it individualized to your care. We work together as a team to decide what that's going to look like. So that is kind of the summary of what to expect at a lactation consultant visit. I'm always happy to answer questions. If you have more questions, you can call up to the office here at Compleo and they can get in touch with me, or you can also find me online at grow.baby.nutrition on Instagram. Thanks so much.